Hello friends, so myself Dr. Maddineni Srinivas. So with so many requests coming from the students to make a very quick revision of the question topic which we are discussing. So we will see a few points about revision points about Duhring Brocq disease, which is other name for Dermatitis Herpetiformis. And so if you have marked the answer as gluten sensitive enteropathy, you are absolutely right. So Dermatitis herpetiformis, it is also called as Duhring Brocq disease or Duhring's disease. So it is basically a chronic relapsing pruritic subepidermal vesicular disorder whereby the antigen is epidermal transglutaminase 3 and it is associated with HLA-DQ2, DQ8, and the important systemic association is of course gluten sensitive enteropathy. Clinically, how does it present? Extremely chronic relapsing pruritic papillovesicles are the primary lesions, and due to this itching component the patients are ultimately going to develop the secondary lesions which are excoriations. And what is the site at which we can see these lesions? It is basically extensor aspect of the body. On histopathology, if we take a skin biopsy, we can see there will be papillary tip microabscesses which are going to have neutrophils. And if we do a DIF, that is direct immunofluorescence, we can identify IgA in the basement membrane zone and also in the papillary tips, dermal papilla. And this is going to be of granular pattern. And what is the treatment of this condition? Because it is triggered by gluten rich diet, so gluten free diet is the treatment of choice, whereas dapsone is the drug of choice. And if you know the answer for what are all the food which are rich in gluten, please comment in the comment section. The clue is, the mnemonic is bro. And one more question, what are the diseases which are associated with inflammatory bowel disease, dermatological disease? If you know the answer, please leave your answer in the comment section. Ulcerative colitis and Crohn's disease are inflammatory bowel disease. And if this kind of quick revision videos are helpful for you, please guys, do not leave this video without hitting that like button, and also subscribe to my YouTube channel for more of this content. And this is tomorrow's MCQ 431 followed by your answer in the comment section, please. So you can follow me on Instagram, you can join my Telegram group, the links are there in the description below. So thank you so much. Happy learning. Myself Dr. Maddineni Srinivas, Sarvam Sri Krishna Arpanam, Sarve Jana, Sukhino Bhavantu.